Look closely at someone's eyes. Not just the color, not just the shape, but the whites, the redness, the shine, the way they move. Because your eyes are doing something most people never realize. They're constantly reporting what's happening inside your body. And sometimes, they start speaking long before symptoms show up anywhere else. We usually think of eyes as tools for vision, but biologically, they're more like exposed nerve tissue, directly connected to your brain, rich in blood vessels, extremely sensitive to changes in circulation, hydration, inflammation, and metabolism. That makes your eyes one of the most honest messengers of your health, if you know how to read them. Here's what makes eyes unique. They have tiny blood vessels you can actually see, transparent tissues that show subtle color changes, direct neurological connections, rapid response to internal stress. When something shifts inside your body, blood sugar, hydration, hormones, oxygen, inflammation, your eyes often respond immediately. That's why doctors have used the eyes for centuries as diagnostic clues, not to replace tests, but to spot patterns early. Most people only pay attention to their eyes when vision gets blurry, pain shows up, or something looks obviously wrong. But the real signals are subtle. Things like dull or glassy eyes, persistent redness, yellowing whites, dark circles that never fade, twitching eyelids, uneven pupil size. Individually, these might seem harmless. Together, they tell stories. Here's the issue. Many eye-related health signals become normalized. People say, "That's just allergies. I've always had dark circles. It's just screens. I'm just tired." But common doesn't always mean normal. Your body adapts, your eyes compensate, and warning signs get quieter, not gone, just easier to ignore. Your eyes aren't diagnosing disease. They're showing stress patterns. Think of them like a dashboard. A single light doesn't mean disaster, but ignoring all of them? That's how small imbalances become big problems. So what do specific eye signals actually mean? In the next part, we'll start with the most common one people notice: eye redness. Red eyes are easy to dismiss. You blame allergies, late nights, screen time, dry air. You rub them, maybe use eye drops, then move on. But persistent redness is often your body waving a small flag, just signaling. Because redness isn't a surface issue, it's a circulation and inflammation signal, and your eyes are incredibly sensitive to both. Eye redness happens when tiny blood vessels near the surface dilate. That dilation can be triggered by irritation, inflammation, oxygen demand. In other words, your eyes are responding to internal conditions, not just external ones. When redness is persistent, something deeper is involved. Low-grade inflammation is a common cause. It doesn't make you feel sick. It just keeps your system slightly on edge. Possible contributors: poor sleep quality, blood sugar swings, chronic stress, dehydration, alcohol, inflammatory diets. The eyes reflect this quickly because their blood vessels are so exposed. Another factor is circulation. When circulation is sluggish, blood pools more easily in small vessels, like those in the eyes. That's why some people notice red eyes in the morning after long days or during fatigue. It's not random, it's timing. Here's something to consider. Is the redness in both eyes or mostly one? Both eyes usually points to systemic stress. One eye more than the other often suggests localized irritation, muscle tension, or posture-related strain. Your body is asymmetrical. Redness shows inflammation and circulation. But what about when the color itself changes? Take a look at the whites of your eyes. Are they bright and clear, or do they look slightly yellow, a little dull, or off-white? Most people assume eye color only matters in the iris, but the whites of your eyes, called the sclera, are highly sensitive to changes in your internal chemistry. Yellowing is associated with bilirubin. Bilirubin is a waste product created when your body breaks down old red blood cells. Your liver's job is to process it. When that process slows down, even slightly, bilirubin builds up, and one of the first places it shows? The eyes. When people hear yellow eyes, they think severe illness. But we're not talking about dramatic yellowing. We're talking about whites that look dull or have a faint tint. These subtle changes can happen long before serious disease. They're early stress signals, not diagnoses. Common contributors include chronic stress, poor sleep, alcohol, highly processed foods, dehydration, long-term medication use. When the liver is overloaded, it prioritizes survival, not optimization, and your eyes reflect that slowdown. Here's an important distinction. Redness usually signals inflammation or circulation. Yellowing usually signals processing and detox load. Different systems, different messages. So redness shows inflammation. Yellowing shows processing stress. But what about eyes that look dull, flat, or lifeless, even when the color seems normal? Have you ever seen someone and thought, they just don't look like themselves? Same face, same features, but their eyes look flat, dull, almost lifeless. That sparkle people talk about? It's real, and it's a telling health signal. Eye brightness isn't about beauty. It's about neurological energy. Your eyes are directly wired to your nervous system. Bright eyes come from good hydration, stable nervous system tone, efficient circulation, balanced stress hormones. When these systems work well, your eyes reflect light clearly. They appear alert. Dull eyes signal nervous system fatigue. Chronic stress shifts your nervous system into survival mode. Blood flow changes, muscle tone tightens, recovery slows, and your eyes lose their softness. This isn't psychological, it's physiological. Burnout shows up in the eyes first. Sleep deprivation makes eyes heavy. Nervous system depletion makes eyes flat and dim. You can sleep 8 hours and still wake up dull if your system hasn't truly recovered. This is why rest alone doesn't always restore energy. One of the first signs of real recovery isn't strength, it's brightness. People often say, "You look rested." That's your nervous system coming back online. Redness, yellowing, and dullness show systemic stress. But what about dark circles, especially when they never seem to go away? Dark circles are one of the most common eye concerns, and almost everyone hears the same explanation: you need more sleep. But here's the truth: plenty of people sleep well and still have dark circles. So what's really going on? Dark circles aren't one thing. They're a combination of anatomy, circulation, oxygenation, and skin quality. The skin under your eyes is some of the thinnest on your body. That means blood vessels underneath show through easily. When circulation is sluggish or oxygen levels are lower, those vessels appear darker. This is why fatigue shows up here first. When oxygen delivery is suboptimal, blood looks darker. This can be influenced by low iron, poor circulation, shallow breathing, long periods of sitting. Even mild oxygen issues can show up as persistent darkness. Chronic stress changes how blood moves. High cortisol causes blood to shunt away from the skin toward vital organs. The result? Darker, more hollow-looking eyes. This is why stress-related dark circles don't disappear with sleep alone. Pay attention to tone. Bluish or purplish circles often suggest circulation or oxygen issues. Brownish circles usually involve pigmentation and inflammation. Gray or hollow-looking circles often reflect nervous system fatigue. Different colors, different messages. Dark circles show circulation and stress. But what about when your eyelids won't stop twitching? That tiny eye twitch, it comes out of nowhere, it won't stop, and it always seems to show up at the worst time. Most people laugh it off, but eye twitching is one of the clearest signs that your nervous system is under strain. Because muscles don't twitch randomly. They twitch when nerve signals become unstable, and your eyes are incredibly sensitive to that instability. Eye twitching, also called eyelid myokymia, is caused by involuntary nerve firing. This happens when nerves are overstimulated, fatigued, or chemically imbalanced. Your eye muscles respond immediately because they're finely tuned and constantly active. Stress is the biggest trigger. High stress increases nerve firing. Caffeine amplifies it. Lack of recovery prevents stabilization. The result? A nervous system stuck in on mode. Eye twitching is often the first place this shows up because the system is already stretched thin. Minerals like magnesium, potassium, and calcium help nerves fire smoothly. When levels drop, due to stress, sweating, poor intake, or stimulants, nerve signals become erratic. Eye twitching is a classic early warning sign, not a crisis, but a request for support. Notice when twitching disappears. Usually after deep rest, after stress resolves, after better hydration, after reducing stimulants. That's your nervous system rebalancing. The twitch wasn't the problem, it was the message. So we've covered redness, color, brightness, dark circles, and twitching. But what about pupil size? Take a look at your pupils, not just how big they are, but whether they're equal. Most people never check. And most of the time, they don't need to. But subtle changes in pupil behavior can reveal a lot about your nervous system. Your pupils aren't controlled by conscious thought. They respond automatically. That makes them a direct window into neurological balance. Pupil size is controlled by two branches of the nervous system. One branch expands them, the other contracts them. This balance shifts based on stress levels, fatigue, emotional arousal, brain signaling efficiency. When the system is balanced, pupils respond quickly and evenly. When it's not, subtle irregularities appear. It's normal to vary slightly, but noticeable asymmetry can suggest nervous system stress. Not necessarily injury, but overload or fatigue. This is why doctors check pupil response during neurological exams. The eyes don't lie. Chronic stress keeps pupils slightly dilated. This puts the system in a constant alert state. Over time, responsiveness slows. People may notice sensitivity to light, difficulty focusing, visual fatigue, headaches, again, subtle signals, but consistent. As the nervous system recovers, pupil responsiveness improves. Focus sharpens, light sensitivity eases, eyes feel calmer. These changes often happen before people consciously feel better. Pupil signals reveal brain balance, but there's one more eye signal, something most people notice in the mirror every day. Burning, stinging, gritty. Dry eyes are one of the most common complaints today, and most people assume it's just screens, air conditioning, or aging. But dry eyes are rarely just about the eyes. They're about what's happening system-wide. Tears aren't just water. They're a complex mixture of oils, fluids, and immune components. When that balance breaks down, eye discomfort shows up fast. Dry eyes often reflect poor hydration quality, inflammation, hormonal shifts, nervous system imbalance. You can drink plenty of water and still have dry eyes if the body can't use that water properly. Inflammation alters oil production in the tear film. Without enough oil, tears evaporate too quickly. This leads to burning sensations, blurred vision, eye fatigue. Again, the eyes respond early. Hormones influence tear production. So does nervous system tone. High stress reduces tear output. Hormonal shifts alter tear composition. This is why dry eyes often worsen during stressful periods or major life transitions. Eye drops provide temporary relief, but they don't fix inflammation, mineral imbalance, or nervous system stress. They quiet the symptom, not the signal. So what does all of this mean in real life? If there's one thing this series should make clear, it's this. Your eyes aren't predicting the future. They're reporting the present. They're not diagnosing disease, they're reflecting balance or imbalance inside your body. And that's powerful information if you know how to use it wisely. Because the goal isn't to stare at yourself in the mirror looking for problems. The goal is awareness, without fear. Your eyes are early messengers. They respond quickly to stress, hydration changes, inflammation, nervous system shifts, recovery, or lack of it. They often show strain before pain, illness, or fatigue force your attention elsewhere. That doesn't mean something is wrong. It means something is asking for support. One bad day doesn't mean anything, but patterns do. Ask better questions. Is this new or persistent? Is it getting better or worse? Does it change with rest or stress? Is it one-sided or systemic? Your body speaks in trends, not isolated events. There's a fine line between awareness and anxiety. Listening to your eyes doesn't mean diagnosing yourself. It means noticing, adjusting, and supporting the basics. Rest, nutrition, hydration, stress management, recovery. When those improve, the eyes usually follow. Some signals should always be checked: sudden vision changes, significant color shifts, persistent asymmetry, pain, rapid worsening. Awareness includes knowing when to ask for help. That's not fear, that's intelligence. Your eyes aren't just windows to the world. They're windows into your health. And when you learn to listen, without panic, without guessing, you start seeing yourself more clearly than ever before.